Hi everybody, this is Kevin, and as you can see, I've got somebody else here with me tonight, and this is going back to my Zoom chats, and I'm with my friend Lara Sargent. Hi Lara, how are you?
Hiya, I'm good. How are you?
Yeah, I'm not bad, thank you. I'm not bad.
Good, good.
We're good. So we're not going to go down this normal sort of route that we've done before, not with you, but with other people, where I would ask them where they're born, etc., etc. But we're here for one particular reason. And about 2 or 3 weeks ago, you and I had a few messages back and forth. And I'm not going to mention the word, and you don't need to mention the particular word that got me so worried, of your state of health. Now, you are suffering from endometriosis.
Endometriosis, yeah.
Yes. Okay. At least I got that bit right.
Yeah.
So, when did you first get any symptoms of endometriosis? Because you're still very young. You're what? You're in your early 20s, aren't you? 24?
I'm 25 now. 25, yeah, 25.
Okay.
Yeah. So I first started getting my first symptoms when I was about 13, 14 years old.
Right.
And you know, before I go into it, I do just want to put a little warning out there that some of it is a bit TMI. Some people might not like to hear about it, but it is reality.
Yeah, absolutely.
And so my first symptoms started when I got my first menstrual cycle. And it was very, very painful. But at the time, obviously, you're told when that starts, you're going to get cramps, and it's not going to be comfortable. So I didn't really think a lot of it, really. And month by month, you know, it didn't get any better, and none of my friends were talking about it. And I went to an all-girls school, and you would have thought, you know, everybody talks about that, but yeah, nobody was really saying anything. And I thought, you know, am I the only person that's getting this pain every month? And I did start to worry, but as nobody was talking about it, I didn't feel comfortable talking about it at the time. I mean, it is a taboo topic, and yeah, it's not something that comes up in everyday conversation. So I think I waited until I was about 17 before. And
sorry to interrupt, but had you not spoken to your mother about it, how you're feeling in the early days when you're 13?
Yeah, she knew it was painful, and the trouble is, she had the same thing. She used to get very painful periods when she was about my age, and she actually has a diagnosis of endometriosis as well.
Okay.
The trouble is, when you're quite young, it can be quite painful when it first starts, just because your body's going through a lot of hormonal changes. So it's quite early to detect something like that.
Yeah.
The only time I ever went to the GP before the age of about 17 was I used to get a lot of urinary tract infections. Almost every month I'd get infections. I was on antibiotics all the time. And I didn't know until actually only about a year ago that that's actually quite common if you have endometriosis.
Right.
So yeah, I mean, I spoke to my mum about it, and you know, some other close family members, but it's quite hard to detect early on.
So from the age of 17, was there any other symptoms you were getting apart from the really bad pains?
Heavy bleeding. But again, you don't really talk about that, and you don't check each other's pads in the toilets.
Yeah, of course, yeah.
So yeah, and I didn't realise that it was heavy until I was about 17. I thought it was normal, and for a very long time I thought that what I was going through was just normal, and I had a really low pain threshold, and I was just being a bit of a wimp. But I initially made contact with my GP around 17. And it was around the time where I was looking at some contraceptive methods, and I tried all different types of pills, mostly to stop the monthly cycle to stop the pain, really, and that was off of my own back before I'd spoken to a GP. And it was, I had the coil. I don't know if you know much about the
yeah,
coil.
my ex-wife used to have that. So
yeah, I had that for about 3 weeks, and it went a bit wrong. I think it was inserted wrong, and it went very wrong. After about 3 weeks, I'd had enough of it, and I got it taken out. And I just in passing said to the doctor, look, every month it's really, really painful, and it's very heavy, and I get very tired. And she put me on a different type of pill. She said, try that out. And it was when I started that pill that I bled non-stop for about 6 months.
gosh.
Which was awful.
Yeah,
and
absolutely.
so it was from then that I started talking more to the GP about everything, and I requested that I had a referral to a gynecologist. I'd been reading online a bit about it, and when I was at university around 18, 19, it's sort of the age where you have nothing to talk about, so you do start to talk about those things.
Yeah.
And it was then when I realized that actually something wasn't right. So I went to the gynecologist, and it was a big back and forth. The trouble with the condition is that general gynecologists don't know a lot about it.
Right.
And the limited things that they do know, they're quite misinformed about, because it's from quite a long time ago when it wasn't really known about. So around the age of 19, my gynecologist suggested that I have a baby to cure my condition.
All right. Okay.
Yeah. Which I want to put out there is not standard practice, and it is not it's not actually a cure. There have been studies to say that it can improve symptoms after having a child. It can improve symptoms, and luckily that's what happened with my mum. You know, she doesn't get half as bad pain as what she used to since having me and my brother. But I equally know quite a few people in the community with the condition that have had children, and actually things have got a lot worse for them.
All right.
So yeah, that's one of the main things that a lot of people get suggested, and is why us as a community get quite frustrated with the system at the moment. There's not enough education about it.
Yeah. Well, I'd heard the name before, endometriosis. I've got to be honest, I didn't have a clue what it was about. And you were the first person that I'd met that suffered from it. And recently did a walk, as you know, which you couldn't come on because you weren't feeling well. And it was only talking to Cynthia Warder and Laura Musco just before we started the walk, when they told me what it does to people, you know, to women. And so that's the first time I actually knew a little bit about it. And it's minuscule what I know. But as I said just now, when we started this, about the messages that you and I had coming backwards and forwards, and that really worried me. And that's why I wanted to talk to you about it, to try and get the message out there a bit more, straight from, shall we say, straight from the horse's mouth, if I put it that way. There's someone that's going through it that can really tell the people what you're going through and what other people might go through. So so after going to the gynecologist, and they suggested, or someone suggested that you have a baby, but that's a bit off the hook doing that. But so from the process from then, where did you go from there?
Immediately I went home in tears, but I was only 19. I was at university, so that's where I went first thing.
Absolutely.
But after then, I went back to my GP and I requested a different gynecologist. I did some of my own research on the NHS website and various other sources. So there's a great charity called Endometriosis UK that has a lot of information on there. And that was when I realised that having a baby is not a solution.
Yeah.
And it's actually quite selfish, really, to, you know, bring another life into the world just for your own benefit.
Yeah.
So I went back and I got a different gynecologist who suggested the same thing.
Right.
And it was quite a theme for a good few years. I had quite a lot of ultrasounds where I kept being told that they couldn't find anything, which is not surprising because it can't be detected on any type of scan.
Oh, right. Okay.
And that's another thing that the medical professionals, the basic gynecologists, they're like GPs. They have a basic knowledge of everything in their area, but they don't know the good details. And it was only until I was 22 that a gynecologist took me seriously, and I went in there. And by this point, I'd learned to be quite resilient and really push for what I needed. And I went in there and I said, I need an operation to find out what's going on. And they put me on that waiting list.
That was a bold thing to say, if I might say that.
Yeah.
Yeah. For someone like yourself to go in and with the knowledge that you built up by doing your own research, and as you say, you built up this resilience, and for you to go in there and say, I need an operation, I think that's very bold to be able to do that. It's amazing.
Yeah, absolutely. And I think you'll find that the majority of people that have now got a diagnosis of it have had to do the same thing to get an answer. And you were saying before you didn't really know anybody that had the condition before me. And this will probably shock everybody when I say that actually 1 in 10 women have it.
Wow.
Yeah.
1 in 10.
Yeah.
Gosh.
So it's really, really common.
Yeah.
And it's so little known about. And, you know, I wouldn't have known about it unless I'd gone and looked into it myself and found out about it. My mum did suggest to me that she thought I might have it because obviously she had it, and it can be genetic.
Yeah.
So she was the person that told me that word, and I was just sat there like you probably were when you first heard the word, and sat there and thought, what is that?
Yeah, absolutely. Yeah. So at the age of 22, were you with Ricky then?
Yes.
You were, yeah. So obviously you've got your partner, your boyfriend,
fiance now.
Then fiance now, yes. You got engaged last year, didn't you? Which was brilliant news.
Yeah.
So with Ricky on board, was that something that helped you to cope with the diagnosis and what you were going to go through?
Absolutely, yeah, definitely. I mean, he's known since before we even got together that I had these issues, because he used to be my employer.
Right.
So if I ever had issues, he kind of knew what it was related to.
Yeah, sure.
And yeah, he's been incredible throughout the whole thing, really. From, you know, going to the GP and being knocked back time and time again to my operation. You know, my operation was in January this year.
Yeah.
So I mean, if you think I was 22 3 years ago, so it took about 2 years to actually get to surgery.
Yeah. So what was the operation you had to have done, Lara? So if I can ask you that.
Yeah, go ahead. It's called a laparoscopy, and it's a keyhole surgery. So they can make between 2 and 4 incisions in your abdomen, and put a little camera in so that they can have a little look at all of your organs, you know, your ovaries and uterus and everything like that. And they have a good look around. Some gynecologists that perform this operation. So some consultants can do what they call ablation surgery whilst they're doing the laparoscopy, which essentially burns out any of these lesions. So endometriosis are little lesions that grow month on month. When you bleed, they bleed, and they grow and they attach. And it's similar to the lining of the womb, but it's not the same tissue. And it grows outside of the uterus, so it can attach your ovaries to the sides of your uterus, and it's been found in every part of the body.
Good grief.
Yeah. I mean, it can spread like wildfire if it's not detected quickly. And ablation will basically burn these incisions out, burn the adhesions is what they're called. And you can get little chocolate cysts as well, which they burn out. That's the most common treatment for it. But the gold standard is what they call excision surgery, where they actually remove the tissue, cut it out essentially. Unfortunately, they couldn't do ablation or excision in my surgery. So that surgery was purely to find out whether I had it or not.
Right, okay.
And I was under for about half an hour. So it didn't take too long.
Yeah.
And he dropped me off and picked me up in the middle of COVID.
Yeah. It's not COVID's bad enough, but actually having to have surgery during that, it's a sort of double whammy for you, wasn't it, really?
Yeah, I was quite lucky because I was put on a priority list, and with all the issues with staffing and things during COVID, I was quite lucky to be referred on the NHS to the private Nuffield Hospital.
Oh, right.
So they had some good measures in place to keep everybody safe. I'm not saying, you know, all the NHS hospitals are doing an amazing job, but at least I had my private room.
Yeah,
So,
of course. Yeah. So you had your surgery and you recovered from that. And then what happened after that? Did things settle down at all, or did they just, you tell us what happened?
So I came out of surgery. It took me about a month to recover from that. And, you know, because they didn't really, they didn't remove any of it, so it was all still in place. Nothing really improved. But over the last few months, I have noticed quite a significant deterioration. And one of my doctors said that it could be from the scar tissue caused by the surgery. But it could be a mixture of things. You know, if they haven't removed any of it and it's still growing month on month, then it's gonna be everywhere. When they did my surgery, they found it on both of my ovaries, my uterus, my kidneys, my bladder, and my bowel.
Oh gosh.
So obviously month on month, that growing it is going to deteriorate until I have my second surgery, which will hopefully they'll be able to remove all of it. Yeah.
And have you got a date for your second surgery?
I'm not even on the waiting list yet, Kevin.
Oh gosh.
Yeah, it's going to be a long road ahead. I don't think it will be at least a year until I can have it. Within a 200-mile radius of where I live here in Aldwick, within a 200-mile radius, there's only 5 specialist consultants that can remove it.
Oh, right. Gosh.
And the 1 in 10 people, if you think about how many women there are in a 200-mile radius, and there's only
absolutely
5 people that can remove it, it's going to be a long wait, I think.
It is, isn't it? Yeah. And I know, when you started messaging me about 3 or 4 weeks ago, you were then just coming to the end of a 5-week spell off of work, weren't you? Because you had not been well at all.
No, I've been really, really poorly, and the common symptoms of the condition, which I now recognise as symptoms that I get that I didn't previously, because I just put it down to hormones, or I don't know, but the symptoms that I get, that I recognize the symptoms now, is pain, heavy bleeding, real bad nausea and tiredness. I get really, really tired. Yeah, there's a whole range of things that can go wrong. And when it flares up, for me, it only usually flares up for about a week at a time, and then it settles down. But that 5-week spell that I just had was pretty horrific. I just couldn't really get up. I was just in constant pain, and I just felt really tired all the time. But I am back at work now, and they're being really supportive.
You've only been back at work just over a week, is it?
Yeah, I've been back about a week and a half now.
That's right. Yeah. Because I know when because when when the messages were back and forth, I was at work, and you said, and again, I'm not going to mention the word, but when you mentioned a particular word, my brain kicked into gear, and I just suddenly thought, I've got to ring her. I've got to ring her up, because just from the messages, sometimes you can read a message that someone sends you, and you can, I don't know whether it's with you or whether it's just with me, but I can tell when someone's suffering just with the words they're using. And I just thought, I've got to ring you up. So I stopped for my morning break, and I rang you up, and we had a chat for about 10 or 15 minutes.
Yeah.
And I I can remember saying to you, I've been thinking, my brain's been working ever since I got those messages, been blah, 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 blah. And you'd said to me then that you'd hardly got out of bed for most of that 5 weeks because you were so poorly. And, it's quite scary when someone and someone as young as yourself is suffering. But I don't know whether this is right or not. Correct me if I am, if I say the wrong thing. But is the real bottom line here that you would have to have, or potentially you have to have a hysterectomy? Or is that the last resort?
It's usually the last resort. So I know quite a few people with the condition themselves, and a lot of them are in their sort of 40s, 50s, and they've had their children and kind of done with all of that, and they've had a hysterectomy, and things have been okay. Some still get symptoms, and it can be quite bad.
Right.
Because the thing about the condition, it never ever goes away. Yeah. It will always be there, and they can remove it time and time again, but it will keep growing back. But the most effective treatment, a lot of people say, is a hysterectomy. I suppose it just reduces the amount of organs that the condition can attach itself to.
But as you said that the people in their 40s, 50s, they've had their families, if they're going to have a family. You're 25, and I know through talking to you that you as you said just now, you've got engaged to Ricky last year, and I'm assuming, again, correct me if I'm wrong, that you and Ricky might like to have a family.
Oh yeah, absolutely.
So and a hysterectomy would be obviously something you don't want to happen, because you want that family. Yeah,
definitely. And so the biggest cause, or one of the biggest causes of infertility, is endometriosis.
Right.
And that can sometimes be an indicator that you have it. So if a couple have been trying for a very long time and they can't conceive, that would be one of the avenues that they'd go down to investigate.
Yeah.
I have not been told as of yet for definite whether I can or can't. In January, when I had my operation, they did a dye test in my fallopian tubes to make sure that everything was flowing properly, and back then it was fine. So hopefully it still is, but they won't be able to tell me for sure until I have this surgery again.
Right. Okay. So I'm being nosy here. Is there any likelihood that you and Ricky might want to start a family sooner rather than late, before you get married, or because of the condition you've got? Tell me to mind my own business if you want.
We've talked about it, and it's still it's still a conversation. I think at the moment, my health is probably number one on our list.
Oh, absolutely, yeah.
And I think we're sort of taking every day as it comes at the moment.
Sure.
I mean, it's definitely on our to-do list. Children is on our to-do list. We just haven't prioritized everything yet.
No, of course. No, as you say, your health is the priority. Yeah, absolutely. So we've talked about your condition. So let's just, so that we're throwing this out there so people know what we've been talking about, and you know what I'm going to probably say, and it's a conversation that you and I had with Cynthia last week, and Steve's now on board. So what we're going to do, and this is so everybody knows, my brain kicks in again. I'm thinking we've got to try and give Lara something to think positively about, rather than her mind being negative. So what we're going to try and do, we're going to try and organise a charity event for next year, for next spring, for Endometriosis UK. Is that right?
Yeah, that's right.
And so we're going to be coming up with all different ideas along the way between Lara, myself, Cynthia and Steve. So it's going to be a long process that we're going to be talking about. We've very early days. We've just touched on the possibility of doing a charity. But we're going to be looking at all sorts of things. If I can just mention, we're going to be looking at perhaps doing a cake stall. We're going to be doing, if we can find the right venue, it'll be people can turn up and have a cup of coffee or a cup of tea and have a bacon roll or a bacon sandwich, or something where they can buy something, but the money would all go to the charity. We're also thinking about doing a walk of approximately 10 miles where people can get sponsored, or they can, along those. If we can do it in a circular walk, so that if people can only do 5 miles, they'll do 5 miles. But also, there's a possibility that we will be doing an evening event. Steve is in a band, and he's going to be talking to the band about the possibility of them doing something in the evening for us. They're a blues band, and they would do that free of charge. So there'll be tickets for sale for that as well. So lots for everybody to think about. So at some point, Lara, we're going to have a meet-up, I hope, and with Steve and Cynthia and Ricky as well, of course.
Yeah.
And we can start mulling things over properly. But by you and I being able to throw that out there tonight, can hopefully get people's minds thinking about any way that they might be able to help out and muck in.
Yeah, definitely. We've got a lot of planning to do, Kelly.
We have. And there's nothing really in the way at all. It's only Christmas.
Yeah.
And then Easter.
Oh gosh. Too early for that.
Yes, I know. Someone put up, I think it was Simon Brown put up on Facebook the other day, only 100 days till Christmas. And I just went, behave.
No,
don't want to know about that.
About Christmas.
I don't want to. Yeah. So, Lara, while we're still on it, is there anything else you want to say to people about your condition that you may not have already mentioned?
Yeah, I wanted to touch on something that I definitely haven't mentioned yet, but we've sort of touched on it a little bit, and that's sort of the mental effects of the condition. And I know that I'm not on my own with it, and it goes for pretty much every chronic condition out there, really. And I think it's very, very common that when you've got something lifelong and it's very debilitating and it can impact every element of your life, like you said, I couldn't make that walk last time, and there's been a lot of plans that I've had that I haven't been able to follow up really, because of the condition. It can really, you know, take a toll mentally on you. And like you said, obviously any age is awful, but I think it really sort of affected me to think about how I'm 25 and I'm not able to go out with friends and, you know, go for a walk, go to work even, because of this condition. It is really, you know, it's tough, and it can cause things like depression and anxiety.
Yeah.
And I'm a massive advocate for mental health, and you know, I'll shout about it till the cows come home.
Good for you. Good for you.
Yeah. And it needs to be talked about more, even, you know, in the modern day. I still don't think people speak about it as much as they should do. And
No, I think you're quite right.
particularly in men as well, you know, men don't talk about it enough. Yeah, absolutely. Men don't talk about it enough. But yeah, I wanted to just sort of touch on how, you know, how dreadful it can be in your head as well as in your body.
Yeah, of
To
course.
have such a debilitating condition. And that was kind of my little rant.
Not a rant at all. It's a very, very fair point. There, you know, particularly over the last 18 months, I think it's made people more aware of what's going on, you know, with people's states of their minds and stuff like that. But particularly for someone like yourself that has been going through this terrible health issue. And I know when we spoke on the phone 3 or 4 weeks ago, it was quite evident from what you were telling me how you were suffering mentally.
Yeah, definitely.
And the effects it was having on you.
Yeah, it's no fun for sure. It does teach you sort of who to count on, and I have sort of learned over the last few weeks, you know, to check up on other people, because I know that, you know, if I hadn't have sent those messages to you, you wouldn't have known otherwise.
No.
And, you know, I think there's quite a lot of people out there that just keep everything to themselves, and it's kind of taught me to check up on other people as well, make sure that they're doing okay.
The messages, I remember the very first message you sent me, it was literally, "Hello, how are you?"
Yeah.
And that is literally how the messages back and forth for that an hour or whatever it was started. It was literally just, "Hello, how are you?"
Yeah.
And
yeah,
I responded saying, "Hi, I'm fine. How are you?" And then that's how this all came about.
yeah. And, you know, I'll ask everybody how they are. And I think a lot of people say, "How are you?" because it's just common courtesy.
Yeah.
But when I ask, I genuinely want to know, because if somebody wasn't okay, I'd probably be the first person to run and help, just like you know, you did when I said I wasn't doing too good, you know. And I think honesty is the best policy.
Absolutely. Yeah.
And I watched a really interesting documentary not long ago about male suicide and male depression and stuff. And the guy presenting it, I don't know if you know Roman Kemp.
I know the name. Yeah, absolutely.
Yeah, it was his documentary, and he sort of implemented a ask twice rule, where if you ask somebody how they are and they just say "I'm fine," try and ask them again in a different way, because the second time usually brings something out.
Yeah, sure. Yeah. It's very good work. Good way of doing it. Yeah,
Yeah, I thought
absolutely.
it was really fascinating.
Yeah. So, Lara, look, I think we've probably touched on everything we need to at the moment. If at some point you feel that there's something else you want to say about this, very happy to do another Zoom chat with you. As you know, I'd help you out as best I can. So let's get this message out there. Let's hope it helps. Even if it helps one person, it's better than nobody hearing this message. And I think it's a very important message. You know, as I said just now, I knew nothing about it. And you know, it's to me, it's very important to get that message out there to try and support the other women out there.
Yeah, definitely. And if I can just say sort of one more thing, you know,
Carry on.
if you are watching this and, you know, you are really suffering in silence with women's health, go to your GP, because pain isn't normal. And I didn't know that for a very long time, but pain is not normal. And I think we're taught quite badly in schools that you're going to get cramps and you're going to get pain, and it's not going to be nice, because actually having bad pain, it shouldn't happen, and something could really be wrong. So definitely speak to a GP. The other thing I'm going to say is, if you don't know what it is, or I didn't explain very well sort of what the condition is, I'd definitely think about having a little look. And Kevin, if you don't mind, if I send you a couple of links, would you mind popping them in the description?
Absolutely.
Just click on the links and have a little read up about it, because it's quite likely that you do know somebody that is suffering with it. 1 in 10 women suffer with it. So if you know 10 women, you probably know what endometriosis is without knowing it.
Yeah, brilliant. All right, Lara, excellent. Thank you very much for doing this tonight.
That's okay.
It's as I said, very important message to get out there. So let's not a problem at all, not a problem. If you know, we'll be talking again. Might see you this weekend.
Hopefully. I'll keep you posted.
All right, Lara, you take care of yourself, and say hi to Ricky from me, and I'll speak to you soon.
Take care, Kevin.
Okay, bye-bye.
Bye.
Bye. Bye.
Hi everybody, my name's Lara. If you've enjoyed watching Kevin's video today, then please follow him on social media, like this video and subscribe to his channel. Thank you.